Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton. Super excited today to bring on one of my partners of Seniors Blue Book, Miss Susan, who's with Bright Star Care. How are you this morning, Susan?
I'm good. How are you?
Very good. Thank you so much. Now, I understand you have a lot that you want to update us on when it comes to the COVID vaccine. But first, tell us a little bit about yourself and how you got started in the industry, and then just go ahead and take it away and tell me everything you want the public to know.
All right. Well, thank you so much. Thank you for your time. This is such a pleasure, and I'm so grateful. So, my name is Susan Nimnuin. I am the Vice President of Bright Star Care of Naples and Fort Myers, and I've been here. Actually, the day this airs will be my 8-year anniversary. So, I'm very excited. I got into this industry accidental. I moved down here from Michigan and was looking for a job at the hospital, which is what my background was in. And I stumbled upon an ad for Bright Star, was curious, came in for an interview, and the rest is history. Um, so now I'm fortunate to be the vice president. And with this, it gives me a lot of opportunity to dive into things that I'm really passionate about, aside from just home care and the Bright Star business. Um, and one of those things for me has been the COVID-19 pandemic and how it has directly affected seniors and the care workers of this industry. Um, Taking it back to the beginning of the pandemic, I think everyone had no idea how long will this be, what will it look like. And I look back now and I think, gosh, I didn't think we'd be in 2021 having these conversations at all. So when it started, the first issue that we saw in home care was PPE. So there was this mad dash, everyone, we need to have so much, it's going to be so limited. And that was true. We were fortunate. We were able to procure enough PPE for our staff and our patients for quite some time. We've not had a shortage there, but it was a struggle. You see the prices go up. You see, you go to the store and it's startling when the shelves are wiped empty and you're nervous. We have a lot of great partners in the community, and we were able to solve that aspect. Then, as the summer approached, ACA had issued the mandate for facilities regarding testing. And when that came out, there were no guidelines for home care. There were no rules, there were no regulations, there was no guidance, parameters, really nothing for us. And the facilities were able to procure their testing through the state contract with Caravita and have the testing done. Their residents, their staff. I'm certainly not going to say it was easy by any means for them, but they did have that option in house. What we struggled with was the home care residents saying, well, we want our staff tested. I myself want to get tested, or my family. What do I do? How do I do that? And I was able to figure that out. We had a partnership with CVS. We did some things with Lee County, and we had all of our staff tested every 2 weeks, just like the facilities were doing. That was not mandated, but it was something that we felt was the right thing to do. And we coordinated that and did that for our entire care team and any patient that wanted that as well. However, that became quite a daunting task to manage, as you can manage. So we purchased a COVID testing machine ourselves. I have a machine in-house that I am able to test all of my staff as well as any patient or their family, and I can take it to them. So they can get tested in the safety of their own home, the comfort of their own home, and know that they're not taking unnecessary risk. So we've had two big hurdles through the pandemic with the PPE and the testing, which we were able to solve. But now we have the third hurdle of the vaccine. And I get no short of 15 to 20 phone calls a day and an inbox full of emails. Susan, when, how, where, who, what about the vaccine? And I didn't have an answer. And that really was hard for me. I'm someone that when there is a problem, I want to find a solution. And I sat back and I looked and I said, how do they get the vaccine? I myself have not been vaccinated yet, and I want to get vaccinated. So, as a healthcare worker, I have the same options that everyone else does right now from the public point of view. Register online with Publix, register online with the health department. I'm up at 5 a.m. every day. I'm up at 6 a.m. I'm up at whatever day these registers are, and I'm on all my devices. We all have tablets and phones and laptops, and we do that. And I can't get a vaccine for myself. And I'm a young tech savvy person. And that got me thinking about my clients in the home that have Alzheimer's or dementia, Lewy body dementia, ALS, MS. I have patients that are quadriplegics, paraplegics, and they don't have that type of ability, but they're just as at risk. Um, which brought me to discovering the real misconception about home care. If you're not in this industry or you don't work closely with our industry, there is this huge misconception. And I have reached out to local government officials, the health department, state elected officials, the governor's office, and the conversations that I have, the common theme I get back is they're in the home, they're isolated, they're protected, they're okay. And I say to them, no, they're not. So, the facilities had the ability during the pandemic to restrict access. So they were able to be in their safe cocoon, so to speak. Now, granted, the caregivers were coming in and the employees, and then that is a risk. But they didn't have the general public per se visiting. In the home setting, I can't restrict that of my clients. So they live in the home with a spouse or a family member, or maybe a neighbor cooks their meals for them. Possibly grandchildren are in the home. Are they going to school? Are they playing sports? What is really the risk coming into the home? And that's just the family and friends aspect. When you think about a typical home care patient, they have a caregiver or two. They have a nurse. Potentially, they have physical therapy, or they additionally could have Medicare services coming in. So that opens up a whole big group of care team members. And the risk there is high. These care team members are working and seeing multiple patients a day. And granted, PPE and all of the safety measures are being taken, but the risk is still there. And the people in the home feel that the vaccine would give them that additional layer of protection that they want. And that started with PPE and testing, and now the vaccine. And that's really where my initiative starts, is bringing awareness and education to what is a typical home care patient. There's such a false narrative. I heard the other day, actually, one of the elected officials says to me, well, they can afford home care. And I said, and the average person doesn't have 24-hour care. The average person has less. So can they afford 24-hour care? Do they need 24-hour care? There's so many conversations to be had when it comes to home care, and just the lack of understanding of what our industry is, who we serve, our population, and what we can do for them.
Yeah, and I'll say too, I think that it's incredibly important to remember that the people in the facilities, they do have that layer of protection, that cocoon, so to speak. People that are receiving home care still have to get their groceries, whether they're being brought to them by a loved one or they're having to go out themselves. When you're doing, just like you're saying, just educating the public, when you're doing private duty, that doesn't mean you're homebound. So you're still
Right.
doing the things that you need to do to keep yourself alive, and that lack of socialization is huge too. So definitely these elders that are 65 and older that are eligible for the vaccine should have every bit of access to it, and having someone come into their home and do that for them would be great. So I know there's a little bit of a misconception as well between the differences between a private pay home care company and a Medicare certified on the skilled side, because you guys are home health, but you're
Yeah.
private duty. So talk to me about what that means for your patients.
So our patients, it's private pay. So they are paying for their services, whether that's via a long-term care insurance policy or that's money out of their bank account. Um, there are some private insurances we take as well. However, we don't take Medicare or Medicaid. So with those services, that's a paid situation for them. Medicare is covering, they're coming in, they're providing this. We work well with Medicare. We can supplement them, or we will follow them if the patient needs to or wants to continue that service once Medicare discharges. But that's the huge part. So our industry of home care, in the private duty side, there's 4 million seniors in Florida, and over 350,000 have private duty home care to some degree. So that's a huge number. Now you think about Southwest Florida, Collier County is a huge area. Lee County as well. We have a vast population of seniors. My average patient, they're over 74, and then we're seasonal. So you're seeing our volume and our population increase right now so much, and it these people need the vaccine. You mentioned their groceries. Some of them have been isolated. They haven't had socialization, and that's true. Some of these situations, the most interaction that they get with another person can be their caregiver. Whether that's a family member or a caregiver that I provide, or if they're with a registry or a private, that's their only socialization. They're not, the community events have really ceased for a while, and you're starting to hear, things are going to come back, and there's going to be a virtual and a live option for things, which is great because there are people that, want to take advantage of a face-to-face real interaction. And there's people that don't, and they want to have the comfort and safety of a Zoom kind of setting. And at the end of the day, though, they're still entitled to the vaccine, and it's not accessible to them right now. There's no easy way for them to do it. And the stress, just the stress of registering, or when is the site open, what day, what time am I on? The vaccines go so quick. And that's a battle I can't fight, nor is it a battle I want to fight. What I want to do, and what I've been doing for the past month, is trying to conduct as many interviews as I can to share with the community about home care, about this population of seniors that are in the home that don't have access like everyone else. There are seniors in the facility. There's seniors that are like my parents. They meet the criteria to get the vaccine. They're over 65 and they're great. My dad plays golf. My mom enjoys doing her activities, but it's stressful for her to get on. And now I think about a senior who isn't like that, has a cognitive impairment, has something where stress is so detrimental to them. How do they do it? How do they get on? Their family has to go to work. They got to do this. It's a tackle. And we want to help them. So my goal is to get enough outreach, enough publicity, I guess, to get the health department to call me back, to get Publix to call me back, to get Walgreens or even the governor. I will go anywhere. I will talk to anyone, a doctor, the health department, a nurse, anyone that wants to talk about this cause or can help. I'm available 24/7, but we want to partner with someone. I'm willing to provide the nurses free. My nurses want to all volunteer their time to go into the home to administer the vaccinations. I have a great administrative team that's willing to help with paperwork or scheduling. We have a dedicated phone line that we're ready to turn on and have just be for seniors to call that line and it be an actual person. So maybe to start, you would get me, and then my entire team would be assisting in the phone. So you would call and speak to someone and register. And you don't have to be a Bright Star patient. I want to do this for my entire community of seniors. So if you are a senior with a private caregiver, if you're a senior with a registry or another agency, if you're a senior in the home and your family is your caregiver, um, whoever you are, I'm here fighting for you. I want to help you get the vaccine if that's what you want. And while I service Schleswig and Collier County, there are Bright Stars all over the state of Florida that want to join in this with me. So if you have family in Delray, for example, their owner is hand in hand with me trying to do this. Tampa, Port Charlotte, up the coast, in the Panhandle. This is what we're trying to do for our state. And, I would love for somehow this to be national as well. There's seniors all over. But I just keep continuing to reach out. So to the Alzheimer's Association, the Alzheimer's Support Network, Parkinson's of Southwest Florida. I reach out to the health department, Publix, Walgreens.
Well, I hope you can get your message across. I know you've done multiple interviews, and we are just so blessed to have you as part of the Seniors Blue Book Network. I know that John Botsko and yourself are very philanthropic, so this just goes to show another thing that you're trying to do for the community. And the mission is very important, and you're very clear with your intent. I can't wait to do a follow-up interview with you where we can release that dedicated phone line and just be prepared for your phone to ring off the hook.
The day that happens, I will be through the roof. It would be such an honor for me to be on here, and maybe we'll be giving the first vaccine to a patient in the home.
I love it. I love it. Well, thank you so much for your time this morning, Susan. Like I said, we appreciate your partnership and what you do for the community, and we will definitely